Day 21 progesterone is not for everyone. If you are running fertility test and you are checking your serum progesterone, that test that they ask you to check on the 21st day of your cycle, you may be doing it wrong. And this is because it's not every lady that needs to check it on that day. It might give you a wrong result simply because cycle lengths differ. A lady whose cycle length is about 32 days, if she checks her serum progesterone on day 21, she most likely is going to get a wrong result. And that's why some of you are carrying certain fertility test results that are misleading you. And you are now treating what you are not supposed to be treating, or not even treating what you are meant to be treating. So in this video, I'm going to be explaining the basic fertility tests that you should be doing and the exact days you should do them, because many of them are very time bound. Hi, I'm Dr. K. I'm a trained medical doctor and I talk about fertility, gynecology, and safe pregnancy. So female reproductive concerns. This is where you get evidence-based medical knowledge. So I want you to stick with me, okay? Now, there are a number of fertility tests. Some of them you can check them on any day, but there are some that are time bound and there are some you have to check on a particular day of your cycle. So the first ones are what we call luteinizing hormone and follicle stimulating hormone, LH and FSH. These ones test the function of your brain, because I keep saying that the first fertile organ are not your ovaries. It's not even your womb. It's your brain. It's the brain that guides and regulates all these things. And if the brain is not sending those correct signals, then it's going to be difficult to take in and have a very safe pregnancy. So LH and FSH are very important, and you cannot check them on any day of your cycle. Okay, you check them on either day 2, day 3, or day 4 of your cycle. So when you are seeing your period, the first day you see your period, your bleeding, your menstrual flow is day 1. So day 2, day 3, or day 4 is when you should be checking them. The next one, very important, is estradiol. Now, typically, estradiol can be checked on any day of the cycle, but we advise you to check it with LH and FSH that I've just mentioned. It may give you an accurate result, but if you check it on any day of the cycle, you don't need to disturb yourself too much because the difference might not be too much. The next one is prolactin. Prolactin can also be checked on any day of the cycle. But let me tell you something about prolactin. It's a very interesting hormone. The best time to check prolactin is in the morning. That's when it gives you the most accurate results. The significance of prolactin is that if your prolactin levels are too high, what it does is that it stops your female hormones from making you pregnant and giving you a normal menstrual flow. So high prolactin is inversely proportional to your female hormone. So you don't want your prolactin to be high. It's enough to stop you from getting pregnant. After that is progesterone. And this is the commonest one people make mistakes, because progesterone is a very important hormone. In fact, is what tells us that you have the ability to ovulate, and checking it wrongly can hamper your chances. Progesterone is a very labile hormone. It's not stable. You can check progesterone today and it gives you a level of 30. Check it the same time tomorrow, it will give you a different result. It's not a stable hormone, and it's very important to get it very correctly. So when is the best time to check progesterone? The best time to check your serum progesterone is in a period of your cycle we call the mid-luteal phase. The mid-luteal phase is approximately 7 days to your next period. So the question comes, my next period, how will I know when my next period is starting? So you can use your previous cycle length. So if you know your cycle length, the days between the start of one period to another period, if you calculate the days, if your own is, let's say, 30, you subtract 7 from that, it gives you 23. So the 23rd day of your cycle. So once your bleeding starts, count 23 days forward in that calendar. The day it falls on is when you should be checking your progesterone. It's going to give you the most accurate result. It's called the mid-luteal phase. These are the basic ones you need to know. I know there are other tests like AMH, testosterone, a number of tests that people like to check, but these are basic ones. And the decision to check those other ones will depend on what the levels of these ones are and what we think your fertility assessment is at that point. So please take note of these days and then share it to people so they can get the right information and get the right results.